Hypertensive retinopathy. It is the damage to the retina and the retinal circulation due to increased blood pressure. Etiology: primary hypertension, no underlying cause. Secondary hypertension, typically the result of preeclampsia, eclampsia, kidney disease, adrenal disease or coarctation of aorta. Symptoms: systemic, headache, ocular, decreased vision, photopsia, diplopia, visual field defects. Signs: systemic, usually asymptomatic. May have evidence of end organ damage, i.e., cardiovascular disease, cerebrovascular disease, peripheral vascular disease or renal disease. Ophthalmic signs: cotton wool spots, microaneurysms, flame-shaped hemorrhages. Retinal arteriolar narrowing, copper or silver wiring. Compression of venules, nipping. Choroidopathy, infarcts may be focal, Elsknig's pearls, or liner along choroidal arteries, Segrest streaks. Differential diagnosis: diabetic retinopathy, collagen vascular disease, anemia, radiation retinopathy, retinal vein occlusion. Investigations: regular blood pressure monitoring, fasting lipid profile, investigation for the underlying disease causing hypertension. Treatment: oral and systemic antihypertensive drugs, treatment of the underlying disease. Thank you.